When Bob and Dave Oriol designed the new Holden Rehabilitation and Skilled Nursing Center located on Mayo Drive, they first considered the needs of area residents. Today, there are 3 distinct units in this beautiful building, each of which offers different services. Joining me is Tara DeAndrea, who's the Chief Administrator here. Hi, Tara.
Hi, Jen. How are you?
I'm great. It's great to be here.
Thank you for being here, and thank you for giving us this opportunity to educate the community a little bit on the multitude of services that we have here at Holden.
Well, let's describe for me each of these different units, if you could.
I will, for sure. So in 2013, the Orioles completed an extensive renovation in which they brought the Wachusett Extended Care Facility residents into this building at Holden. So one of our units that we have is our chronic ventilator unit and respiratory unit. We have a traditional long-term care unit, and our focus has really been on building our short-term rehab business with the newly designed short-term rehab unit. One of the nice things about that unit, and I think something that sets us apart from some of the other facilities, is that we have all private rooms, private bathrooms, and most have private showers, which is very important for the type of rehab patients that we're seeing come in.
Right, and I think a lot of people don't realize that you can also just come for an appointment for rehab and go home. I mean, it's open to the general public. You don't need to be staying here short term, right?
Absolutely. So in addition to the short-term rehab services that we offer, and for the patients that come in on our short-term rehab wing, we have a complement of physicians and physician extenders that come in, including orthopedics, pulmonary, wound doctor, and a neurology group that comes in. One of the nice things about our Oriol Therapy Services is they can treat our patients here, but what a lot of the public doesn't know is that it's also outpatient therapy for the general community. So one of the things that we see as a benefit for coming here short-term rehab is once they're discharged home, they can still come back and have a nice continuity of care with the same therapists.
Right.
But in addition to that, if you're just looking for short-term rehab, you can absolutely come and be an outpatient at Oriol Therapy Services.
Yeah, it's so impressive, all the services and the different populations that you can serve now, all under one roof, which makes it a real treat, right?
It's very nice. And in addition to that, we have some lovely amenities. It's a beautiful facility, but we have a wonderful coffee shop, we have a beauty salon, among other things. It's just really a home-like environment, and people have described it as coming into a place where they feel like they're in a healing environment, and it makes it easier to get back on track and get home.
And that's what it's all about, right?
Yes.
Yeah. So, well, I'm looking forward to hearing more about Oriol Therapy Services, and I think we're heading over to talk with Maria.
Yes, Maria is waiting for us, so we'll head over there.
Okay.
Thank you.
So I'm here now with Maria Pappas, who is the Director of Rehab. And Maria, you're also a physical therapist.
I am, Jen, yes.
Which is terrific. So how excited are you for this new facility?
We're very excited with our facility and the wonderful accommodations that they built for us.
It's a beautiful building. And now we can break this down into 2 parts, right? First is short-term rehab. Tell me a little bit about that.
We've had short-term rehab here at Holden for years. And most recently, once they did the renovation, they added private rooms for our patients, private bathrooms, and that's been a great value add. And we also have physicians that come in as part of our clinics. So we have a great team approach here.
So give me who are some of your typical patients?
We have patients who've had strokes. We've had patients who've had orthopedic surgeries or pulmonary respiratory therapy patients. We have a lot of patients on oxygen. We have people who have had car accidents, just the full gamut. We have people who've fallen off of ladders or hurt themselves shoveling snow.
Okay, so it runs
a little bit of everything.
Full range.
Yes.
And so then to help them become fully functioning again, you offer what, speech pathology?
We do. We have physical therapy services, which everyone's pretty comfortable with what physical therapy is. We have occupational therapy and speech therapy services. My staff are all full-time members, and we offer services up to 7 days a week for our inpatients, which has been a great value. And my staff is a very strong clinical team.
That's terrific. And I've seen the rooms. They're gorgeous. They have private bathrooms, right?
Yes, they do.
Beautiful.
Yeah, nice use of light. Everything's open airy and very nice.
Well, and I think the other thing people don't realize is that you can come up here for outpatient therapy.
We did. We opened up outpatient services once we moved into our new setting, and we have our own separate entrance, private parking, plenty of private parking. And the feedback that we've gotten is people really enjoy not having to go into the city.
Sure.
And it's here, it's close to home. Parking is ample. We are able to schedule patients sometimes the next day when they call us for new evaluations. and our receptionist is able to help with insurance verification, authorization, so it's kind of the full service.
Well, and it's really as simple as if something should happen to you, you can say to your doctor, can I be serviced at Oriol Therapy Services?
Right, absolutely.
And just get a referral, and it's that easy.
It's that easy, and people don't have to be here for rehab first as an inpatient. That's something that we love having our patients who have come in for rehab, go home, have their home care, and then graduate to come back to us as outpatient.
Right.
They feel so comfortable because it's staff that they know, a facility that they know and they're comfortable with, and we know what their common goals are. But then it's open to the community. We've had young girls who've been injured dancing. We've had people who just, they're runners, they want to get back to it. We have people whose goals to, hike the mountains.
Right.
So we have a little bit of everything.
And that's the key. It's people of all ages.
Yes.
If you need help, you guys are here.
Call us, we're here.
To do it.
For the speech and outpatient for occupational therapy as well. Those are services that I understand are pretty hard to find other places. So we do encourage people just to ask for us.
Sure. Well, let's focus on the speech for a minute, right? I
Okay.
think we're going to talk to one of the therapists.
Yes, Shana.
Okay.
Shana
All right.
Smith, yes.
Thank you.
Okay.
I'm here with Shana Smith, who's a speech therapist here at Oriol. Shana, you said there's a lot more to this than speech, right?
Absolutely. I have patients who the first thing they say is, speech therapy, I talk fine, why do I need speech? But we really do work from the neck up. It's different from when you were a child and you were learning the S sound or learning how to speak. When we're working with adults in geriatrics, it's different. We do everything from swallowing to speech and language therapy to thinking skills therapy. So after a stroke, after Parkinson's, after head and neck cancer, sometimes a patient will have trouble swallowing or they can't eat at all. So it's my job to get the person eating again, doing something that was normal and natural before, that's now a health hazard after they have a certain diagnosis. So that's the swallowing piece. Then we move up to speech therapy. Somebody who's hard to understand or somebody who has trouble with their language after a stroke. We've all known somebody who completely lost the ability to speak after a stroke. We use a lot of technology for somebody who can't use their own voice anymore. We may need a computer to speak for them. I think everybody should have the right and the ability to communicate with their loved ones. And then the last thing that we work on is cognitive therapy as well. It's not something that seems like we would with speech therapy, but we do a lot of apps. Somebody who may come in and needs to work on their medication management, we'll sit them down and learn how to organize a pill box, or somebody who has gotten into a car accident and they say, I'm having trouble remembering after my car accident, or as I age, I'm having trouble remembering words. So we can do...
There's a whole range of services that
Absolutely.
you yourself offer, which is amazing.
Right, and so both short-term
Okay.
but also outpatient.
So show me how you would use an iPad, just as an example.
So this is just an example of something fun that you can do with somebody that's engaging and colorful. It can work on visual scanning, attention span, memory. So in this case, we're just finding the numbers as fast as we can. 1, 2, 3, 4, 5. What it will do is it will calculate a number. It will calculate a time that it took for the person to find the numbers. And I can keep data to see. It's not just me saying you're doing a good job, but we actually have the data that can show us progress.
That's true. It's amazing how technology plays a part now, right?
Absolutely. It's
Whole
so
new
much
tool
fun.
for you,
Yes.
sure.
And patients can, the apps that we use in therapy, they can download them at home and use on their own devices so they can practice outside of therapy as well.
Well, and I think it's important, speaking of being home, to note that your services aren't only for the short-term rehab people
Right.
who are here.
Right.
You can come in, you can be referred by your doctor and come in and see you right in Holden, which makes it so easy.
Absolutely. Yep. If you have trouble with your memory, you could go to your doctor. They'll come send you to Oriol, and we can do a comprehensive cognitive evaluation and decide where we need to go from there.
Well, it's so nice to have you in Holden, I have
you.
to say that. So thanks for taking the time to talk with us.
Thank you.
Now we're going to shift our focus to occupational therapy and helping people do those everyday tasks. Joining me now is Melissa Decker, who's an occupational therapist here at Oriol. Hi, Melissa. Hi. It's great to be here with you. Can you tell us a little bit about what you offer in terms of services?
We offer, as far as occupational therapy goes, a lot of people have the misconception that it's just looking for a job or finding a career. But what we actually do is to work on the tasks and the activities that are important to people's everyday lives. So self-care, cooking, cleaning, taking care of pets. And also work can be a part of that, but it's not just the primary focus. and we also focus on an outpatient level. We do lymphedema management,
Okay.
strengthening.
So some of your typical patients would be who?
Would be anyone who had a sudden illness or an accident, someone who had a surgery, cancer survivor who just had a surgery. That's where the big focus is on the lymphedema management.
Okay.
Someone who has COPD or CHF exacerbation. We focus a lot on the daily skills with self-care and meal prep, which you'll see in a few minutes.
And the ultimate goal is just to get everybody back functioning
Yes.
with everyday tasks. And
Yep, just to help get them stronger and bridge that gap between where they are and where they want to be from where they were before, and to get them so they can go home.
Okay, and so some of the tasks you would have them do, what would you have them do in the kitchen?
In the kitchen, we'd have them get everything ready to prepare a meal. Usually we do light meal prep things like make a grilled cheese or make scrambled eggs, make sure that they can get all the materials ready, access the refrigerator and the stove safely, that they remember to turn it off, and then also that they can clean up the dishes and put them away when they're done.
And these are things that you just do automatically, but you're right, you need to go back and do it step by step
Yes.
and really think about it.
Yeah.
Yeah.
And it's when a lot of people, that's when they realize that all of a sudden when they can't do it anymore, they realize the things that they really take for granted and what you do in your everyday life that you can't do if all of a sudden you get weak or you have an illness.
Sure. And you too work with younger patients also. I
Yes.
know we have a younger patient who you'll be working with. What will you be doing with him?
Working on some hand strengthening exercises just to try and build up that strength.
Okay. All right. So, and like you said, short-term and outreach too. I mean, if anybody has an issue, they can get a referral and just come see you in Holden, which is
Yes.
so convenient, right?
That's right.
Yeah, it's terrific. Well, thank you. We appreciate you taking the time. Tara, we learned so much today about the services offered here at Oriol.
Thank you, Jen. We've loved being part of On the Road with the Chamber, and we hope that the community has learned a little something about Holden that they didn't know. Please keep an eye on our website and our Facebook page for more information.
There you go. Thank you.
Thank you.